Hey there, this is Tom's PT Tips. We're talking neck strengthening today, so revisiting an old friend, the injury equation. So again, this equation, understanding this equation, how to manipulate the two variables is the key to long-term management of your aches and pains within your body. So when forces on a tissue or body part are greater than what that tissue can resist, we get pain, injury, or tissue breakdown. Talked in previous videos about the neck, how to reduce forces on the neck. One of the videos was on sitting and sleeping positions, two common positions we tend to stress our neck. Other video, we did the posture blitz series. We got a bunch of posture exercises, which are also designed to take stress off your neck. So today we're focusing on how to increase that neck's ability to resist force. Need to go over some anatomy first. So which tissues are the most common to break down in the neck? Remember, it's that C4 to C7 disc. Again, why is that? Well, we have that stiffer thoracic spine and rib cage beneath the neck. This is a fairly mobile area, and so when we move our heads, this is the area things tend to pivot and slide around. It's that sliding shearing force that is the most damaging to tissue within the body and the most damaging to these discs. So C4, C7 tend to be that area of breakdown, so can we strengthen those discs? No. Similar to the low back, we couldn't strengthen L4, L5, but the key is to strengthen those muscles that limit those shearing forces and protect those discs. Muscle anatomy. So there's three key muscle groups we focus on to strengthen and stabilize the neck, very similar to the low back. So one thing you can see right here is these neck muscles come off the top of the shoulder blades. Several of our big neck muscles come off the top of our shoulder blades. So the shoulder blades is actually the foundation of the neck area. First muscles we need to go after to strengthen are these mid-back muscles. This creates the foundation for your neck muscles to work off. Key muscle in the mid-back area is this lower trapezius. Lower trapezius not only helps kind of set these shoulder blades and stabilize them, but lower trap also holds our shoulders back and helps extend our thoracic spine. When we're rounded in forward positions, our head gets pushed forward. When our head gets pushed forward, there's that forward shearing force on C4 to C7. So this, for multiple reasons, your mid-back is key to start with when strengthening your neck and trying to stabilize your neck better. Next muscle group we're after are the deep neck extensors. So research has shown, similar to your low back, when they look at people who've had a history of neck pain and those who haven't had neck pain, the number one finding in the neck, similar to low back, is there's atrophy of this deep extensor muscle that sits down on your spine. It's called multifidus, the tubular muscle that sits right on top of the spine, functions to limit the shear force and the sliding around of those vertebrae. Last muscle group we got to strengthen for neck issues is strengthen the deep neck flexors. When we're in forward head positions, the deep neck flexors get stretched and weak, and so it gets hard to hold our head back in that neutral position. These deep neck flexors, deep in there, are these skinny little strap muscles. So here's another point that's interesting, is you'll notice when we talked about plantar fasciitis, and we talked about low back issues, neck issues, rotator cuff issues in the shoulder, we're strengthening these deeper stabilizer muscles that aren't large muscles, but they help control movement of bone and they stabilize two bones on each other. So you don't need a lot of resistance with these exercises because you're going after small muscle groups with these strengthening things. So we're going to show about 10 video clips, some of them upper back strengthening exercises, some of them neck extensor strengthening, and some neck flexor strengthening. Pick maybe one or two of each of these, and even if you do 5 to 10 reps of these a day, you're going to help reduce those shear forces and you'll have a less painful neck and upper back. A couple super simple exercises to activate that mid-back and that lower trapezius are one we showed in the posture video where you just gently squeeze those shoulder blades down and back. Lower trapezius pulls the shoulder blades backward, but they also pull them downward. So that down and back will activate lower trap. Adding a little resistance to it, you can take a TheraBand like this, just put it out in front of you, and just squeeze those shoulder blades down and back. Don't shrug as you pull the band outward. 10, 20 reps will fatigue out that lower trap. All right, 3 simple exercises you can do with the TheraBand attached to a door handle. First one, simplest. You're going to just pull those arms toward your side, bend in the elbows. We call this the row in the boat. Gently pull those shoulder blades down and back as you do this. Don't shrug the shoulders. Another mistake is don't pull those elbows so far back because that puts stress on the neck. So down and back, lift the chest. Second one, more difficult. Elbows back, rotate the arms backward, and then come back and repeat. This activates not only that mid-lower trapezius, but it also hits the back part of your rotator cuff, which gets stretched and weak when we're in forward positions. It's an exercise baseball pitchers do. Next one, even more difficult. You're going to start here. You're going to go up into the Y position. Again, don't shrug the shoulders. Squeeze them down and back. Lift the chest. So a nice three-step progression to strengthen the mid-back and lower trap area. This next exercise is to strengthen the shoulder blade stabilizer muscles, including the lower trapezius, but we're also going after a muscle called the serratus anterior. Both of these muscles together help stabilize those shoulder blades to the rib cage. This exercise also, we're going to target a little deep neck flexor. You take a TheraBand, you go hands and knees. Now, you want to tuck in that chin to activate those deep neck flexors. Round that upper back so your shoulder blades aren't winging out. Hold that real stable, and then you're going to raise this arm up. As you raise that arm, make sure you're not shrugging the shoulder. A couple sets of 10 to 20 on both sides. Great for getting more stability into those shoulder blades and actually starting a little bit of deep neck flexor strengthening. Good. This is a three-step progression of strengthening the lower trapezius. First step being the easiest, third step being the hardest. Key on this, again, to get lower trap, you got to bring your shoulder blades down and back, not shrug them up toward your shoulders. As you shrug, you activate upper trap. Upper trap tends to be really strong and active on people. Lower trap tends to be inhibited and weak. So the three steps. First one is to be arms at your side. You're going to squeeze the shoulder blades down and back, and then lift the arms up off the floor. Making sure you don't shrug. Make it a little more difficult, we go to the goal post position. Same deal, squeeze shoulder blades down and back, and lift arms. Toughest one is the Y position with your arms out in front of you. Squeeze down and back, and lift. Great way to strengthen up lower traps. Usually the first step in starting to strengthen those deep neck stabilizers are called isometrics. Isometrics are where you hold your head in neutral position and you push with your hand to activate the muscles. So the front of the head activates the deep neck flexor muscles. Couple points here is you don't want to push so hard that the sternocleidomastoid, the strap muscle, kicks in. That's a sign you're overstressing those deep neck flexors. Other thing is you want to bring your hand to your head. Don't bring your head to your hand, it puts you in a bad neck position. So neutral posture, push against the head, 5-second hold, gentle. Back of the head activates the deep neck extensors and multifidus. Side, 5 seconds. Front corner activates those deep neck stabilizers that limit rotational forces on C4 to C7. Nice thing with this, 5-second holds, maybe 2 to 3 reps even a day is going to help increase some of the stability and support around C4 to C7. One of the simplest exercises to strengthen your neck is the chin tuck. We've showed this one on previous video. Just basically tucking the chin in, gliding the head backward. This activates those deep neck flexors. To add some resistance to this, take a TheraBand, put it on the back of your head, and you can retract against resistance. So tuck in the head and release. Again, about 10 reps will help strengthen those deep neck flexors, and you hit the extensors a bit. You hit some multifidus with this. Ball on the wall. And being a dad of Disney girls here, we have Minnie Mouse Ball. This is an exercise that activates those deep neck flexors and the deep neck extensors. So the deep neck flexors are this first one. Gentle chin tuck, tuck that chin in, a little pressure into the wall, then you're going to turn your head, about a 50% turn. And then to the other side, you can repeat this maybe 5 reps till those muscles fatigue a bit. To activate the extensors with this exercise, that multifidus muscle, it's backside of the head, little chin tuck. So we actually are activating both the deep neck flexors and extensors with this one. Keep that chin tucked. Again, about 5 reps. Fatigue out the flexors and extensors. This next exercise is my favorite shoulder exercise, but I use it for my neck patients and I find it helps people with neck issues. So you're going to lift your chest up, chin tucked in, and you're going to elevate these arms up. We call this scaption. You're going to elevate these arms up, hands going up to about to shoulder height, and then back down. You're going forward at a little bit of an angle. So this targets the top tendon of the rotator cuff, which is why it's so important for shoulders. But it also, by holding my chin in and my shoulders down and back, I'm activating the deep neck stabilizers and my upper back muscles. Now, I typically do this with weights. You can start without weight and then work into some small dumbbells with this. Great exercise to activate those stabilizers, neck and upper back, along with strengthen that rotator cuff tendon. These last two exercises are a little more aggressive for those deep neck flexors and deep neck extensors. Flexors first. You lay on your back. Tuck the chin in, activate the flexors, lift the head up about 1 inch off the bed, and then back down. You only have to lift about 1 inch. Tuck, lift, lower. So don't crank that neck up very high. The other one, to the edge of the bed. Gonna tuck the chin in again. Hold that tuck as you lift the head up to where your face is parallel to the floor. This activates the deep neck flexors and those deep neck extensors in that multifidus. Usually 10 reps of each of these is enough to fatigue out those deep muscles. Remember, they're not very big muscles.